Good day everyone, and welcome to this presentation by Alis Healthcare. Today I will be teaching on tuberculosis, TB. Tuberculosis, TB, is a chronic infectious disease caused mainly by Mycobacterium tuberculosis. It primarily affects the lungs, pulmonary TB, but can also affect other organs, extrapulmonary TB. TB remains one of the leading infectious causes of death worldwide. Tuberculosis is a communicable disease caused by Mycobacterium tuberculosis complex, transmitted mainly through airborne droplets from an infected person. Causative organism. Mycobacterium tuberculosis. Acid-fat bacillus, AFB. Slow-growing aerobic bacterium. Resistant due to waxy cell wall containing mycolic acid. Types of tuberculosis. 1. Pulmonary TB. Affects the lungs. Most common form. Highly infectious. 2. Extrapulmonary TB. Affects organs outside the lungs. Lymph nodes, bones, spine, Pott's disease, kidney, brain, TB meningitis. Abdomen. 3. Latent TB. Bacteria present but inactive. No symptoms. Not contagious. 4. Active TB. Bacteria multiplying. Symptoms present. Contagious. Epidemiology. Common in developing countries. Increased prevalence in O-HIV patients, O-malnourished individuals, O-diabetics, O-immunocompromised patients. Mode of transmission. TB spreads through airborne droplets, coughing, sneezing, talking, singing. A person inhales infected droplets released by a patient with active pulmonary TB. Risk factors: HIV/AIDS, malnutrition, diabetes mellitus, smoking, alcoholism, overcrowding, poor ventilation, poverty, immunosuppressive therapy, close contact with TB patient. Pathophysiology. 1. Inhalation of TB bacilli. 2. Bacilli reach alveoli. 3. Macrophages ingest organisms. 4. Formation of granulomas, tubercles. 5. Caseous necrosis develops. 6. Latent or active disease occurs. The primary site of infection is called the Ghun focus. Clinical features: pulmonary TB symptoms. Persistent cough, greater than 2 weeks. Hemoptysis, blood in sputum. Chest pain, fever. Night sweats, weight loss. Fatigue, loss of appetite. Extrapulmonary symptoms depend on organ affected. Neck swelling, back pain, headache, neurological symptoms. Abdominal pain. Diagnosis: 1. Sputum examination, acid-fast bacilli staining. Zeal-Nielsen stain. 2. Gene expert test. Detects TB DNA. Identifies rifampicin resistance. 3. Chest X-ray. May show cavitations, infiltrates, fibrosis. 4. Tuberculin skin test, MAN2 test. Detects previous exposure. 5. Interferon gamma release assay, IGRA. Used for latent TB detection. 6. Culture. Gold standard but slow. Treatment of tuberculosis. First-line anti-TB drugs, remembered as HRZE. H. Isoniazid. R. Rifampicin. Z. Pyrazinamide. E. Ethambutol. Standard TB treatment regimen. Intensive phase, 2 months. HRZE continuation phase, 4 months. HR total duration, 6 months. Mechanism of action of anti-TB drugs. Isoniazid. Inhibits mycolic acid synthesis. Rifampicin. Inhibits bacterial RNA synthesis. Pyrazinamide. Active in acidic intracellular environment. Ethambutol. Inhibits cell wall synthesis. Side effects of anti-TB drugs. Isoniazid causes peripheral neuropathy. Rifampicin causes orange discoloration of body fluids. Pyrazinamide causes hepatotoxicity, hyperuricemia. Ethambutol causes optic neuritis. Drug-resistant TB, multidrug-resistant TB, MDR-TB, resistance to isoniazid. Rifampicin, extensively drug-resistant TB, XDR-TB. Resistance to stored isoniazid. Rifampicin. Fluoroquinolones. second-line injectable drugs, prevention of tuberculosis, BCG vaccine. Given at birth, protects children against severe TB. Other preventive measures. Early diagnosis and treatment, good ventilation, proper cough etiquette. Use of face masks, screening close contacts, adequate nutrition, nursing management, isolate infectious patient, monitor drug adherence. Educate patient on completing therapy. Monitor for side effects. Encourage nutrition and hydration, complications of TB, massive hemoptysis, pneumothorax, respiratory failure, meningitis, spinal deformity, death. Directly observed treatment, short course DOTS involves 1. Government commitment, 2. Sputum microscopy, 3. Standardized treatment, 4. Drug supply, 5. Monitoring system. Summary. TB is caused by Mycobacterium tuberculosis. Spread occurs through airborne droplets. Persistent cough greater than 2 weeks is important symptom. HRZE is standard treatment. Drug adherence is essential. MDR-TB is a major public health problem. Short questions. 1. Define tuberculosis. 2. List 4 risk factors for TB. 3. Mention first-line anti-TB drugs. 4. State 4 symptoms of pulmonary TB. 5. Define MDR-TB. Multiple choice questions. 1. The causative organism of tuberculosis is A. Streptococcus pneumonia, B. Mycobacterium tuberculosis, C. Staphylococcus aureus, D. Escherichia coli. Answer B. 2. Tuberculosis is mainly transmitted through A. Water, B. Food, C. Airborne droplets, D. Blood transfusion. Answer C. 3. Which drug causes optic neuritis? A. Rifampicin, B. ethambutol, C. Isoniazid, D. Pyrazinamide. Answer B. 4. Which vaccine helps prevent severe TB in children? A. OPV, B. BCG, C. DPT, D. Hepatitis. B. Answer B. 5. Standard TB treatment usually lasts A. 1 month, B. 3 months, C. 6 months, D. 12 months. Answer C. Conclusion. Tuberculosis is a preventable and curable infectious disease. Early diagnosis, proper treatment, adherence to medications, and preventive measures are essential for controlling TB and reducing transmission. Thanks for watching. Please subscribe, like, and share.